You might not realise it, but every minute your heart is supplied by a network of arteries no thicker than your little finger. When one of these arteries narrows or blocks, it can starve your heart of oxygen, and that is when chest pain or even a heart attack can strike. But thanks to a remarkable procedure called coronary angioplasty, doctors can reopen those arteries from the inside, often within hours, and restore life-saving blood flow to the heart. Hello, I'm Dr. O'Donovan, a licensed medical doctor here in the UK. In this video, I'll explain what coronary angioplasty is, why it's done, how the procedure works, and what recovery looks like. We'll also discuss the risks, the alternatives, and what you can do afterwards to protect your heart. As always, this video is for general education only and not a substitute for individual medical advice. So what is coronary angioplasty? Well, coronary angioplasty, sometimes called percutaneous coronary intervention or PCI, is a minimally invasive procedure that helps to widen narrowed or blocked coronary arteries, the vessels that supply blood to your heart muscle. Now, the word angioplasty literally means vessel reshaping, and it's done using a tiny balloon that's inflated inside the artery to squash fatty deposits against the artery wall. In most cases, a short wire mesh tube called a stent is also inserted. Now, the stent acts like a scaffolding to keep the artery open, allowing blood to flow more freely. Once in place, the stent stays in permanently. Now, why is it done? Well, coronary angioplasty is used to treat coronary heart disease, where arteries become hardened or narrowed by a buildup of fatty material called atherosclerosis. If the narrowing limits blood flow, it can cause angina, which is chest discomfort brought on by exercise or stress. When medication isn't enough, angioplasty might be recommended to restore proper blood supply. Now, it's also used as an emergency treatment for heart attacks where a clot suddenly blocks a coronary artery. In this situation, angioplasty can be life-saving. It restores blood flow faster than clot-busting medications and significantly improves survival. So what are the potential benefits? Well, most people notice that their chest pain improves, they can be more active, and their overall quality of life increases. If you've had a heart attack, angioplasty reduces the chance of having another and increases long-term survival compared with clot-dissolving drugs. So now let's discuss preparing for the procedure. Well, before angioplasty, you'll meet your cardiologist to check that the procedure is suitable for you. This appointment includes blood tests, a general health check, and a review of any medications that you're taking. You may need to adjust or pause certain blood thinning or diabetes medicines, so always follow your medical team's advice. Now, you'll usually have something called an angiogram first. This is an imaging test that shows exactly where the blockages are. Often, if a blockage is found, the doctor can continue straight on to perform angioplasty during the same procedure. Typically, you'll be awake throughout with a local anaesthetic to numb the area where the catheter goes in. Sedation can be given if you're anxious. You can usually eat a light meal beforehand. So let's now discuss how coronary angioplasty is performed. Well, the procedure takes place in a specialised room called a catheter lab. You'll lie on your back on an X-ray table connected to heart monitors. A small incision is made in the wrist, the arm, or the groin, and a short tube called a sheath is inserted into the artery. Through this, the cardiologist threads a thin, flexible catheter up to your heart under continuous X-ray guidance. A fine wire is passed down the catheter to the narrowed section of the coronary artery. Over this wire, a tiny balloon is positioned at the site of the blockage. When the balloon inflates for about 20 to 30 seconds, it pushes the fatty deposits aside and widens the artery. You might feel some pressure or even mild chest discomfort whilst the balloon is inflated. This is completely normal and should settle as soon as it's deflated. If a stent is being placed, it will already be mounted on the balloon. When the balloon expands, the stent opens with it and stays in place as the balloon and catheter are removed. The doctor checks that the blood is flowing freely using a small amount of contrast dye. Once everything looks good, the instruments are withdrawn, the access site is sealed with pressure or a small dissolvable plug. Straightforward angioplasty typically takes 30 minutes to 2 hours. So now let's discuss briefly what happens after the procedure. Well, typically you'll rest in a recovery area for a few hours whilst your heart rhythm and blood pressure are monitored. Most people go home on the same day, but you might stay overnight if it was an emergency procedure or if you've had a heart attack. Now you'll need someone to drive you home, and you should avoid heavy lifting, strenuous activity and driving for about a week. Now, it is normal to have some bruising or tenderness where the catheter went in. Now you might want to know about stents and medication. Well, there are two types of stent: bare metal stents, which are simple wire mesh tubes, and drug-eluting stents, which slowly release medication to prevent the artery narrowing again. Now, most modern angioplasties use drug-eluting stents because they significantly reduce the risk of recurrence. Now, if you have a stent fitted, you'll need to take blood-thinning medicines, usually low-dose aspirin for life, plus another drug such as clopidogrel for up to a year. Now, it's crucial never to stop these medicines early, as this could cause a clot to form inside the stent. Now, finally, what about recovery as well as lifestyle changes? Well, after a planned angioplasty, most people can return to work after about a week. Recovery after a heart attack-related angioplasty may take longer. Now, you'll be offered cardiac rehabilitation. This is a program that helps you to regain confidence, manage your risk factors, and return to normal life safely. Lifestyle changes are also really important. So this means stopping smoking, eating a balanced diet, low in saturated fat and salt, keeping active, maintaining a healthy weight, and taking prescribed medicines exactly as directed. Finally, let's talk about risks and alternatives. Well, coronary angioplasty is generally safe, but like all medical procedures, it does carry some risks. Common minor effects include bruising or bleeding at the insertion site, and rarely serious complications can occur, things like heart attacks, strokes, or damage to the artery, but these are uncommon, particularly in experienced centres. Now, if your arteries are severely narrowed or affected in several places, your team may recommend something called a coronary artery bypass graft, also known as a CABG. Now, this involves using a healthy blood vessel from another part of your body to bypass the blocked artery. If you found this video helpful, please subscribe for more medically accurate explanations, share it with anyone you think might find it useful, and why not check out this video next.